Complete guide to root canal treatment, procedure, benefits, and aftercare. Root canal treatment is a common dental procedure that is performed to treat dental problems that affect the pulp of a tooth. The pulp is the soft tissue that is found inside the tooth, and it contains blood vessels, nerves, and connective tissue. When the pulp becomes infected or inflamed, it can cause pain and discomfort, and if left untreated, it can lead to more serious dental problems. Root canal treatment is an effective way to remove the infected or inflamed pulp and save the tooth from extraction. In this video, we will discuss everything you need to know about root canal treatment, including what it is, how it works, when it is necessary, and what to expect during and after the procedure. What is root canal treatment? Root canal treatment, also known as endodontic treatment, is a dental procedure that is performed to treat problems that affect the pulp of a tooth. The procedure involves removing the infected or inflamed pulp from the tooth and then cleaning and filling the root canals. The root canals are the small, thin channels that run from the pulp chamber to the tip of the root. The purpose of root canal treatment is to save a tooth that would otherwise need to be extracted. When the pulp of a tooth becomes infected or inflamed, it can cause a range of dental problems, including pain, sensitivity, and swelling. If left untreated, the infection can spread to other parts of the mouth or body, leading to more serious health problems. How does root canal treatment work? Root canal treatment typically requires 2 or more visits to the dentist. During the first visit, the dentist will take an X-ray of the affected tooth to assess the extent of the damage to the pulp. The dentist will then administer a local anesthetic to numb the area around the tooth. Next, the dentist will create an opening in the top of the tooth to access the pulp chamber. Using small, specialized tools, the dentist will carefully remove the infected or inflamed pulp from the tooth. Once the pulp has been removed, the dentist will clean and shape the root canals to prepare them for filling. In some cases, the dentist may need to apply an antimicrobial solution to the root canals to eliminate any remaining bacteria. Once the root canals have been cleaned and shaped, the dentist will fill them with a rubber-like material called gutta percha. The opening in the top of the tooth will then be sealed with a temporary filling. During the second visit, which is usually scheduled a few weeks after the first visit, the dentist will remove the temporary filling and replace it with a permanent filling or a dental crown. A dental crown is a cap that is placed over the tooth to provide additional support and protection. When is root canal treatment necessary? Root canal treatment is necessary when the pulp of a tooth becomes infected or inflamed. This can occur as a result of tooth decay, gum disease, or trauma to the tooth. Some common signs that you may need root canal treatment include severe tooth pain, especially when biting or chewing, sensitivity to hot or cold temperatures that lingers after the stimulus is removed, swollen or tender gums around the affected tooth, discoloration of the tooth, a small bump on the gums near the affected tooth. If you are experiencing any of these symptoms, it is important to see a dentist as soon as possible. Delaying treatment can lead to more serious dental problems and may even require extraction of the tooth. What to expect during and after root canal treatment? Root canal treatment is generally a safe and effective procedure that is well tolerated by most patients. During the procedure, you may feel some pressure or discomfort, but the local anesthetic should keep you from feeling any pain. After the procedure, you may experience some. Thanks for watching.